More than 1 million Canadians are living with cancer right now, and their treatments and support are being affected by the global focus on the pandemic of COVID-19. To talk to us more about this situation is Andrea Seale. She's the CEO of the Canadian Cancer Society. Good to have you with us on your morning.
Hi, thank you. Nice to be with you.
Great to have you here. What are your biggest concerns that you're hearing from people who are right now living with cancer, whose treatments and visitations and check-ins with doctors have all been affected by the healthcare system dealing with COVID-19?
Well, yeah, that is what we're hearing. We know that people are feeling very anxious about how to protect themselves and their loved ones from COVID-19, but also that the interruptions to their treatment and their care create a tremendous amount of anxiety. And as they have less contact with their friends and family, this creates a huge amount of isolation and concern, because when you go through cancer, you so often rely on a network of friends and family to help you cope with it. So we've been hearing a lot of anxiety, and we've been really trying to get the word out to let people know that they don't have to go through this alone, that the Canadian Cancer Society is just a click or a phone call away, and that we have a lot of great ways to help people cope as we get through this.
Well, why don't you walk us through some of those ways that you're supporting cancer patients right now?
Sure. Well, like everybody, we've had to do as much as we can to move our usual supports online. And so we've really augmented those services through this. We have a cancer helpline that can talk to people in 200 different languages. And we have a really wonderful community that is called cancerconnection.ca that's filled with other patients and survivors and who have been through this, who've been through things together before and are helping them now.
What about you as an organization, the Canadian Cancer Society? How are you facing challenges as an organization trying to provide care?
Yeah, it's really tough. So many people are struggling through this, and April is Daffodil Month. April is the time when we're usually out in the community raising awareness about cancer and raising funds. And we've had to cancel hundreds of events, of course, try to move as much as possible online. But it's creating some challenges with our fundraising at the time when people really need us most. So we've launched a COVID-19 emergency response fund so that we can raise money to help keep our essential services going through this.
Andrea, as we're looking ahead and we're starting to hear some provinces who are talking about reopening plans, what are some of the concerns and what do you want to see for patients as we start allowing people back into our hospitals for treatments, for support?
Yeah, well, what we really want to see is that that care starts getting back up to normal speed. So we know that the healthcare system has been in such an impossible situation. They've really had to prepare for the worst, and maybe we won't actually experience the worst, and we can start to see the light at the end of the tunnel now. So we'd like to see treatments, surgeries getting resumed. That's the key to good care, is timely care. We know that there's going to be a backlog that has to be worked through, but that our healthcare system is going to have to adjust to giving cancer care even while COVID is still with us. And so that's what we want to see most.
Andrew, really quickly, somebody who's living at one of the 1 million Canadians living with cancer at home right now would love to hear from you. What would you say to them, somebody who's struggling with anxiety over loss of treatment, loss of surgery?
Yeah, I would say reach out. Don't do this on your own. There are people who can help. There are people who will help you cope. There's others who are going through the same thing, and we will get through this by helping each other. So reach out, cancer.ca.
Andrea Seale, I want to thank you for joining us today.
Thanks a lot.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.